Hello everyone and welcome to our Monday Minute. Today we're here to discuss the recent OIG report regarding the lack of appropriate reporting of major injury with falls for home health patients being admitted to the hospital. They found in their research that 55% of the hospital stays that were the result of a fall at home with injury, major injury in many cases, did not have that appropriately documented on the OASIS. In fact, many cases found no OASIS at all when the patient has been hospitalized. So we need to discuss two things. First of all, OASIS transfers must be completed anytime a patient is admitted to a facility for greater than 24 hours for anything other than routine testing. When that is the case, the transfer OASIS does include J1800 and 1900, which are the items that would record falls and the severity of the fall. In the situation with the transfer OASIS, even if you, for example, came into the office on Monday morning and discovered that the patient went to the emergency room on Saturday and then was admitted as a result of a fall, that transfer OASIS must be completed and must be transmitted to the OASIS database. In regard to J1800 and 1900, 1800 allows you to document that the patient did have a fall. And then in 1900 is where you're going to document the severity of that fall, whether it was related, an injury that was related to the fall, there was no injury at all, there was injury except major injury, and then there was an injury that was major. The major injuries including bone fractures, joint dislocations, closed head injuries with altered consciousness and subdural hematomas. Those major injuries should be reported when they are the result of a fall, and any injury, even if not major, that again was the result of a fall. Again, the heightened issue here is the OIG discovering that 55% of major injuries resulting from falls were not documented in the OASIS. And again, multiple cases where the OASIS wasn't even completed at all. We are confident that the OIG recommendations will be carried out by CMS, which is to put much more higher scrutiny on agencies regarding their completion of OASIS timely and the accurate completion of the injury section that results from falls. It's imperative that OASIS education be provided in your organization to specifically highlight the falls situation and ensure that your transfer OASIS are not just being completed, but are being transmitted to the OASIS database timely. At HPS, we do provide OASIS education. We will provide you the link to the OASIS education that can be purchased and downloaded, as well as a link to the OIG report. We hope this information has been helpful. Thank you for your attention, and we hope you have a fabulous beginning to the fall season.